Okay, we have a lot to talk about today. This is not going to be short. And we're here to talk about more than just the coronavirus. As we gather today to give you a very full and detailed briefing about what Texas is doing to prepare for the coronavirus and to keep Texans safe, we're also dealing with another challenge as we speak. It deals with a busted water main in Houston, Texas, that's causing serious problems for the Houston and Harris County area. I want you to know that the Texas Division of Emergency Management personnel, they are on site at the City of Houston Emergency Operations Center. I have requested state agency personnel to coordinate with both city and county officials to fulfill any unmet needs. State personnel are ready to respond to any request for assistance by local officials. We anticipate the following needs to arise. One is for water. Another is for personnel to help set up points of distribution to provide that water. The Texas Commission on Environmental Quality is ready to assist city and county officials and leaders with any water quality issues. And the Texas Department of Transportation is ready to assist with any road and or rail transportation-based issues. Now on to the coronavirus. And so you'll know I'm going to provide you a detailed explanation of what Texas is doing. And then I will have Admiral Knight from the CDC make a few comments, and then we will open it up for questions. First is I just got off a telephone call with Vice President Pence, who, as you know, has been placed to be in charge of dealing with the coronavirus issue in the United States. He provided me an update about what the federal government is doing, the ways that the federal government will be working with state governments, as well as how we can collaborate together to make sure that this is going to be aggressively dealt with. And so I want to express my gratitude for both the Vice President as well as the President for the way that they are stepping up to respond to this and to assist us at the local level. The Texas state agencies have been working on this for well over a month now. I'm going to give you a detailed explanation of all that the state has done. DSHS, the Department of State Health Services, is the lead agency in the state's response. DSHS is working closely with the Texas Division of Emergency Management to coordinate and plan for the state response to COVID-19. DSHS and the Texas Division of Emergency Management are working with other state agencies as well as local health departments and healthcare providers. DSHS activated the State Medical Operations Center on January the 31st. That center serves as a touch point for any request from local entities and also ensures consistent collection, tracking, and reporting of public health activities and data. The Texas Division of Emergency Management is helping to coordinate the response and numerous state agencies that are available to assist when called upon. DSHS is preparing the state laboratories within the Laboratory Response Network to administer the coronavirus test. DSHS has coordinated with the Texas Education Agency, Texas Commission on Jail Standards, the Higher Education Coordinating Board, as well as other state agencies to notify their local partners and institutions regarding steps that can be taken to mitigate against the virus. DSHS leads daily calls with public health authorities and healthcare providers to ensure communication is flowing from the state to local providers. These calls have included 500 to 600 people per call, and they begin on January the 24th. DSHS leads weekly calls with county officials and higher public education institutions to ensure that our local communities and schools are equipped with the information necessary to mitigate the spread of this virus. DSHS leads separately a daily call with San Antonio city officials. As you know, there are some people in San Antonio involving this situation. So they are dealing with the local emergency management and the local public health department to foster constant state-local communication and to plan for the current and future needs of San Antonio to augment the federal repatriation mission at Lackland Air Force Base. DSHS is updating public health response plans to be prepared for the possibility of community transmission of COVID-19 in Texas. I'm not saying that's happening. I want you to know that we're just preparing for any possibility. DSHS established a web page specific to COVID-19 to share up-to-date information regarding the rapidly changing situation. DSHS is encouraging other state agencies to refer those with questions to the web page or DSHS personnel to ensure messaging regarding the state response across agencies. I talk about this web page. I don't have it down here. Where are you? What is the web page address?
It is dshs.texas spelled out .gov/coronavirus.
One more time.
dshs.texas .gov/coronavirus.
And that is a location where local officials as well as individuals in Texas can access to learn more about this.
Yes, sir.
Great. And then DSHS, the Governor's Office, the Texas Division of Emergency Management, the Texas Department of Public Safety participate in White House, Federal Health and Human Services, as well as CDC updates related to COVID-19. The next is the Texas response to the federal repatriation efforts. And this information will be augmented by Admiral Knight shortly. But Texas DSHS established capacity at the Texas Center for Infectious Disease in San Antonio to reduce pressure on local hospitals, and that capacity includes 22 negative pressure rooms that are sealed off from the rest of the facility. Do we need this?
No,
Got it. All care provided to patients at the Texas Center for Infectious Disease is being provided by the Infectious Disease Response Unit housed at the State Department of State Health Services. The Texas Center for Infectious Disease capacity is being used to care for the following types of patients. Patients with minor symptoms who are being tested for COVID-19. Patients who are positive for COVID-19 but have minor symptoms. And patients who are recovering from COVID-19 but who are no longer clinically sick enough to remain in the hospital. What I have here is that 5 of the 144 individuals from the Diamond Princess have tested positive for COVID-19 as of February the 26th, and all 5 are receiving care at the Texas Center for Infectious Disease. Next is what's categorized as Texas Community Surveillance Operations. DSHS and local healthcare providers are educating the community at large on the signs and symptoms of COVID-19 so that community members know to notify their local health department if symptoms develop. The Department of Health and Services in Texas and local health departments are contacting returning commercial travelers from China to oversee the monitoring operations of returning travelers. Returning travelers contact their local health departments daily to report their temperature and any other symptoms. DSHS works directly with the CDC lab to identify persons who should be tested and coordinates with the CDC when test results are reported back to the state. Next, I want to cover ground about existing state plans and guidance procedures. The state has response plans for emergency situations like what we're dealing with right now. The agencies are not starting from scratch. Instead, they are using historical knowledge gained from responses to other infectious disease emergencies, including H1N1. The state plans include emergency support plans that are operational plans about how to respond to situations like this. They include respiratory virus plans. They include the H1N1 action report, the Ebola after action report. They also include local health department guidance for healthcare personnel and criteria to guide evaluation of a person under investigation. DSHS has produced guidance documents to be used by state agencies to ensure consistent messaging regarding the state response to COVID-19.
The National Weather Service.
She had a dream that became a legacy.
She always
On such documents to send to school districts about how to promote good hygiene measures in the classroom. So we have planning meetings and work groups. What we're doing is we are preparing for all possible contingencies. DSHS is surveying varying levels of patient care capacity around the state to contingency plan for a scenario if the state has a community spread of COVID-19. I cannot emphasize enough that has not happened. Our goal is to make sure we're prepared if something like that were to happen. DSHS and the Texas Division of Emergency Management are planning to begin bi-weekly meetings right here with all relevant state agencies at the State Operations Center. These meetings will begin Tuesday, March the 3rd. Agencies will discuss current state emergency planning documents and how the plans will be implemented during the state response to COVID-19. This planning will include different scenarios ranging from the status quo to extreme pandemic so that we can be prepared for anything that may happen along the range of potential outcomes. All various responses will be discussed. DSHS and the local health departments regularly participate in planning response exercises to prepare for public health emergencies. The Texas Division of Emergency Management is developing an academic advisory group of the state's university systems with the purpose of informing the state's preparedness and response activities to all types of disasters, including COVID-19. DSHS, in coordination with the Texas Division of Emergency Management and the Texas A&M School of Public Health, will be convening work groups to help inform state agency development of COVID-19 operational plans. These work groups will be composed of experts with on-the-ground perspectives to ensure operational plans address Texans' needs. Public awareness. DSHS is continuing to push proper hygiene education campaigns to the public using media platforms. Other agencies are implementing disinfecting measures at public gathering places like driver's license offices and schools. DSHS is coordinating with the state's institutions of higher education on the latest developments in research and treatment methods for COVID-19. DSHS is working to ensure high-risk populations, including the children, the elderly, and those in healthcare facilities, to ensure that they are prepared and properly cared for. This includes coordinating with daycares and nursing homes and assisted living associations on education about how to mitigate the spread of COVID-19, as well as proper disinfecting measures. DSHS is also working with the Texas Hospital Association, the Texas Medical Association, to provide educational materials the associations can then, in turn, provide to their members. Long story short, there's a tremendous amount of work that all these state agencies, the state health leaders and emergency response leaders have put in for well over a month now to be extremely well organized. But they did not start from the beginning a month ago. They built upon knowledge gained in responding to the Ebola challenge as well as the H1N1 challenge. And so they come with batteries included when it comes to being able to respond to this. We have an extremely robust, well-informed, activated force prepared for any potential outcome that we may have to deal with. The last thing I want to add, in addition to what Dr. Hellerstedt mentioned about the state's website, and that is a good location for the public to go to learn more about this, is cdc.gov. And with that, before we open it up for questions, I would like Admiral Knight to come up here and explain to you more about what is going on in San Antonio.
Thank you very much, sir. Good afternoon. I will talk a little bit about the situation that is happening in San Antonio and our partnership in San Antonio. We are working very closely with JBSA Lackland, which has served as the home for our repatriated Americans from 2 flights that have landed in San Antonio. One flight, which was from evacuees from Wuhan, China, of which 90 of those individuals were successfully completed their quarantine and were medically cleared and went to their homes just last week. And then the second flight contained individuals who were American citizens being repatriated from the Diamond Princess cruise ship. So a little bit about the numbers that we have and the partnerships that we have there. I mentioned JBSA Lackland. We're also working very closely in collaboration with DSHS, with the San Antonio Metro Health Authorities, and other local partners on the ground. We heard about the TCID, which is a significant asset there as well. Currently, we have 145 repatriated individuals who we are watching across our sites. Let me break down those 145. In terms of the number of positive coronavirus cases that we have in Texas right now, we have 10. The breakdown of that 10, 2 are individuals who had been from Wuhan cohorts. One that was part of the Wuhan group that landed here, and another one is an individual who was brought back to Texas to be closer to family as she completes her isolation and gets ready to be discharged. So 2 that are from the Wuhan groups. We have 8 individuals that are from the Diamond Princess group, 4 that have been tested since they have been here and have been confirmed to have coronavirus through CDC's test. We did have 5, as you mentioned, Governor. One of those we were able to successfully move to be able to join a spouse to complete isolation together at another facility. So we have 4 that remain. We also have 4 additional positive individuals who are positive for coronavirus, whose test results from the testing they received in Japan came to us through the Japanese government after their arrival here. So all of those individuals who have tested positive are currently in isolation off the base, where they are in various stages of recovery from their illness. The other individuals are currently in quarantine on the base, and under quarantine, that basically means they are asymptomatic. We check them twice a day. We monitor them for fever, as well as for the common symptoms, which are cough and difficulty breathing. So as long as they remain asymptomatic, they continue to be housed on the base to receive our services there in quarantine. And if anyone were to develop symptoms during the 14-day quarantine period, then we would follow the procedures as you outlined, whereby they would be transferred to the local healthcare facility for evaluation, which includes the testing for novel coronavirus. So I'll go ahead and stop there. Thank you.
Very good. Thank you. Now we'll take some questions.
Are there any concerns with deployed soldiers coming back to Texas, and what's being done about that?
Okay. I'm going to first let the general answer, and then I'll follow up.
Sir, currently we are in contact with our troops that are deployed overseas, and we're monitoring them, and also the information that they're getting from the bases that they're on, what to do, and then we'll follow whatever DoD protocol is put in place, because there's a lot of troops deployed right now, so we'll put something in place along the way.
Well, by Southwest, we have a lot of international visitors, and it's a huge festival here in Austin. What are you guys concerned about that, and what is the preparedness for that?
Sure. We remain in constant contact with local health officials, and that any decision about South by Southwest is a decision that would be made by local health officials. But again, the DSHS maintains daily contact with them. We're here to assist in any way they need.
Hey, Governor, in the briefing that you had next door, you had mentioned that the likelihood of anybody catching it and dying from this disease is relatively low. Could you elaborate on that and how you know what you know, so you can kind of share that information with everybody else?
Well, I'm not a doctor, and I don't play one on TV, and so I would have to leave it to the medical profession to discuss what the potential death rate would be or anything like that.
But we did hear you say something to the effect of that the chances of it happening are very low. I'm just hoping that you could shed some light on where you're coming from.
Yeah, I would defer that to the medical profession.
Governor, I have a viewer asking on social media, has the state made plans for potentially closing public places such as schools if we do start seeing community spread, or at what point do we start?
Sure. So the state has made plans for every possible outcome. So you'll know already this school year, there have been more than 50 school closures just for the common flu. And so this is something that school districts are accustomed to dealing with. For a school closure, for example, it would be up to the local school authorities to make that decision, with, once again, state officials being available to assist them in any way.
Will the state be giving any money, or the governor, would you be giving any money at all through funds to help in the creation of vaccines like the ones being developed in Houston?
Well, on most of the vaccines, those will be through either federal and or private funding. As you probably are aware, there are some private companies that are working on vaccines, some working privately solely, some that may be working in conjunction with public entities. And so it would just differ depending on who it is. What I do know is that there is a race to come up with vaccines for this, and they are moving at great, swift speed.
Governor, do you hear from down here, in the case of San Antonio, have you heard of any pushback from locals about concerns about anybody who's tested positive being kind of in the community and what the impact might be?
I haven't. I'll open it up to anybody else who may have any different information.
Dr. Ellison. Abbott.
Hi, John Hellerstedt. I'm the Commissioner for the Texas Department of State Health Services. Everyone who is in the community right now has been, if you will, if they were part of originally that original group of folks who were repatriated from Wuhan, if they live in Texas or other communities throughout the United States, they were not allowed to be cleared out of their quarantine until they had had negative tests to assure that they were free of the virus. So there really is no such thing as a person that is positive shedding virus in the communities as a result of the repatriation efforts.
Can you shed any light on how many test kits the state had? And most of them are kind of going to CDC through Alabama, but does the state kind of have a certain number that they're working with?
Again, John Hellerstedt, I don't know the number that we have. I know that we have been given a green light to proceed with the validation process for testing, not only at the state lab here in Austin, but at other members of what we call the Laboratory Response Network that are in the state, and they're proceeding to begin the validation sequence for that, and that will take some time. So I don't know about the exact numbers.
A few more questions.
Governor, are you getting any assistance from the federal government in terms of financially? Are you satisfied with what you're getting from Washington?
Yeah, in my conversation with the Vice President, we talked about this. As you may be aware, Congress is considering legislation as we speak that will provide billions of dollars in funding to address this particular virus. We don't know yet how much may be allocated for the states. The Vice President made it sound like they were very committed to assisting the states in any way possible. And so we'll have to wait and see how much funding Congress provides.
Is any state international travel being curtailed as a result of this? Planned trip to convention?
No.
Last question.
In the worst case scenario, would you guys shut down public transportation and shut down any cities?
Well, if you want to engage in worst case scenario, that's a hypothetical I can't get to yet. All I will tell you is that we will plan for any potential outcome, and it just depends on what the exact facts are.
We're actually going to get a last one right here with Alan Morris.
Commissioner, you mentioned that there was a validation of test kits. What does that mean, and are they being distributed throughout communities and counties? How is that coordination actually working?
Right now, the test kits are being made available to public health laboratories through the CDC, and the validation process is to assure that the tests are sensitive and specific and reliable. And that is a technical process that has to take place in order for us to establish that we can have that reliable testing here in Texas.
Thanks, guys. We've got to run.
Okay, thank you all.